Okay, guys, can you see me and hear me? Uh, Guys, please drop a thumbs up in the chat so that I can start the presentation. Okay. So, firstly, hi, achievers. Myself, Dr. Vikram. Today we are here for the one of the very important thing that is like how to analyze a question and to get a maximum marks. That is like see, we will be in a situation like where we are panicking, right? So we are not aware of like what are all the questions that are going to come and how the questions are going to come, how we need to analyze the questions so that we can answer correctly. That I'm going to discuss based on the different type of questions that is going to be. Firstly, simple questions that is like a somewhat like a lengthy, but just a simple question that is like if you know you can answer it directly. You can see like Richard-Collins syndrome is characterized by anomalies of ear microtia, cleft lip, and palate and mandibular deficiency. You can see the underlying all the options. See, the thing that you have to remember is these kind of questions are going to be answerable if at all if you know the basic concept. You can answer it just fraction of 20 seconds, maximum of within 20 seconds. Just like you will read the question and thereafter you can just answer it correctly. That is like anti-mongoloid palpable fissures, which is the correct answer for the Trichinosis syndrome. So you can answer it as soon as possible if at all if you know. And these kind of questions should be answered within 20 to 30 seconds. That's it. Not more than 30 seconds you should take. Because the main time management thing is for the 180 minutes you have 240 questions. That is like 240, 180. That is like somewhere around 1.5 question per minute. That's how you have to think. Then only you can answer it properly without any adbert. Okay. And the second kind of questions that are going to come is a lengthy one, which is going to be based on the case scenario thing. You can see a 60-year-old male complaints of difficulty eating food because of decrease in the mouth opening, burning sensation of the oral mucosa, with a long history of smoking on the examination, blanching of mucosa is seen, and this condition is known as. See, here you have to remember is that is like, firstly, we will be getting confused and we will be panicking because seeing this much big question, am I going to answer it correctly or not? And it is going to consume very much time. See, these kind of questions are going to be somewhere around uh, 40 to 60 questions are going to be these lengthy questions. That is like which going to take approximately 1 minute of time is going to take. But you don't need to panic about it. It is like more bigger the question, more hints do you have. That is like suppose if you are doing some any kind of pressure and kind of thing. If you get more hints, that means you can sort out the issue right easily. That's how you have to understand the basic concept. That is like firstly 60-year-old male patient. That means males are more frequently the one who are going to consume the smoking, but shifting in the lifestyle as observed. That is secondary part. But difficulty in eating food, okay, due to decrease in mouth opening. That means mouth opening has been reduced. There is a reduced mouth opening. Normally, it is going to be 40 to 50 mm. That is like we can observe within 4 digits. It is a digital examination is going to be done. If at all 4 digits are going to be passed, then it's normal. 3 digits, okay, class 2. 2 digits, it's going to be class 3, and 1 digit is going to be class 3, 4 condition, severe condition. So, and thereafter burning sensation is seen in the oral mucosa. Why? Because of tobacco chewing, the muscles have been and oral tissues have been inflamed. And examination, you can see blanching of mucosa is seen. So you can understand 1 inch, 2 inch, 3 inch, fourth one, and this is a fifth one. So you're going to sort out it easily. That is like decreased mouth opening is seen in oral submucous fibrosis, right? Because the muscle undergo fibrosis, so thereby the muscle opening, that is like the masticatory muscles which cannot open the our mandible. So thereby resulting into the decrease in mouth opening. So this is how you have to analyze. More bigger the question, more clues. So thereby you can answer it very quickly. These are the second set of questions which are going to be somewhere around 40 to 60. And coming to the 60-year-old, you can see it is also like first question kind of thing where there is just a modification of second and first question where they will be asking a case scenario but only just in two lines. You can see a 60-year-old female is having a punched out lesion in the skull and bilaterally in mandible. Her parathyroid hormone level is 97 picograms per ml and serum is 11 picograms per deciliter. What will be the diagnosis? Here you have to understand females. So the females much more commonly affected diseases you have to analyze. They have the punctured out lesion in the skull and bilaterally in our mandible. There is a punctured out lesions in the skull and mandible, and thereafter the PTH level, that is parathyroid hormone level, is 97 picograms per ml, and serum it is going to be 11 micrograms per deciliter. So you have to understand one clue, two clue, and three and four clues are present. So thereby, females are much more frequently affected with the thyroid thing. Okay, in that you can see parathyroid hormone level has been increased. So thereby, it is going to come under the hyperparathyroidism. Okay, simple thing. You have to analyze the question. It is not just like whatever you have studied in the some other manner, so you will be answering in that manner only. You have to modulate according to the question paper. That is like how to think. That is like bigger the question, you don't need to worry. Just have to be figuring out based on the factors that are present. Okay. So hints are much more important thing in the just game of right. Similarly, here also they are important. So more bigger the question, more the hints. So definitely you can answer it much more precisely without any confusion. And you can see over here, these are the image by based questions, which are going to be majority one, like somewhere around like 60, somewhere around 760 approximate of questions going to be image based questions. You can see it is a identify the given appliance. If you know the answer, you can answer it just in 10 seconds. These are the questions that are going to be much more in number because they want to split you in the 240 questions. They want to split 60 questions going to be tougher questions. That is like case-based scenarios going to be present, which is going to consume 1 hour of time. That is 60 minutes. And thereafter, somewhere around 120 questions will be direct questions. If you know the answer, you can just answer in just 10 to 20 seconds. That's it. No more thinking at all. You just have to click on the right option and thereafter you just need to submit. Like that, sorry, it's not submit, and save. Click on the option and then save. Like that, you can proceed. And thereafter, another questions that is like another 60 questions going to be the questions where the combination of first and second. So you can observe, right? Like that, the pattern is going to be present. That is out of 240 questions, 60 questions are going to be the lengthy questions, 120 going to be direct questions, 60 questions are the one which are going to be somewhat like in a mixture of both 1 and 2. So thereby you can answer it very quickly at all. You don't need to worry about like time. Even if like at the same time you need to have a good proper time management. There is like okay, I will waste the time. It's not like that. You have to think each and every question. See, suppose if you see in a bigger question, then it doesn't need to panic. That question should be having an about 1 minute of time. Means 1 minute of time should be given. And another direct set of questions you should be answering very fastly. If at all not, then leave the question because this see, identify the given appliance is the question that is seen. If you know, you will be answering just in a matter of 10 seconds. That is ups appliance. If you don't know, even if you break your head, also you will not able to get the answer. And also sometimes you need to think in the uh subtraction manner. That is like activator. You know that it's like it is present in the both maxilla and mandible, and it is a acrylic and metal based components are present. In the bionator also, it is like acrylic along with metal component which is present in both maxilla and in mandible. And pendulum appliance is an appliance which is going to be present in the center of the palate. So thereby you can rule out like that also. If at all if you don't know this one, you can just do by subtraction method. That is the one of the very important thing. You can just sit and relax. If at all if you get an answer in a just matter of 10 seconds, answer it. Otherwise leave the question, move on to the next question. Because like if you don't know the at least subtraction part also, if you cannot figure it out, then leave the question, because like it is going to waste the time. No matter how much how many hours you think also, it is not going to come into your mind. Only thing, if you know the question, you will be answering it. That's it. So always try to be like a much more faster rate and much more precise. I say like see, suppose you think like the answer you can answer it, then only proceed for it. Otherwise leave the question. Okay, percentage of contraction of the elastomic materials. These are the ascending orders and descending orders. These are also like easy questions, but at the same time, definitely this is going to take some 20 seconds. Definitely it is going to take, because you know that like addition silicone has a least contraction and polysulfide has a higher contraction rate. So, but you have to arrange them in a proper sequence. That is like polysulfide, condense silicone, polyethers, and addition sequence. Here it is a descending order. That is like firstly polysulfides, then condensed silicones, then the polyethers and addition silicones are the one which is going to have a very least percentage of contraction. So here you have to think about that is like you know the answer, but you need to arrange them in a proper sequence. If at all they give you a pen and paper in the examination hall, definitely do write it on the paper. That is like addition silicone. So it is going to be least. Okay, followed by polysulfide is the one that is the highest. Polysulfide followed by condensed silicones. Then, okay, in between that is a polyether. You can just do like that, and then you need to answer. And then also you need to be much more cautious, because sometimes what you see is like they are present like this, but they can be in a vice versa manner also. They can be like a descending order or ascending order. So you need to be very cautious. Very cautious means very cautious when you are answering these kind of questions also. It's a simple thing, but you should be answering it properly, provided if you know the subject knowledge. At the same time, you should be comprehending like what is present and how we need to answer it. Like that, you should be thinking about it. Not just like I know the answer, I will answer something that like that. You should not be thinking. You should be like very much patient. And now we know that like that is like the pattern has been changed, where the exam is divided into two parts, part A and part B. Okay, here the 140 questions, here the 100 questions in the part A. That is going to include your medical subjects, and it is going to include your dental subjects, and it is going to somewhere around it is 75 questions, or sorry, 100 questions and 140 questions, and you have to split the time. That is like they have split it into the 75 and one that is like a 115. So 105. They have split the time into this pattern. So after the 75 minutes of time, this part is going to get completely closed. That is like you cannot access to it, or also you cannot edit anything. And thereafter only the second part will be opening. This is one of the very important thing that you need to be aware of, because like whatever you are going to answer in the 75 minutes, do answer. At the same time, if you have any check, that is like if you set the questions like a check later, then definitely review it before the 75 minutes, because see here time management is one of the very important thing. At the same time, it is not that it's like you are not aware of the time, because you are going to have a time over this area where you will be displaying the 180 minutes. In that, how much minutes of time is left, and also it will be showing you how many seconds of the time was been spent to the each and every question also will be showing to you. So you need to be very very cautious and also very much aware about it. And definitely never ever ever forget that save and next is the one of the very very important thing. No matter how much good the answer you have marked, but if you don't click the save and next, then definitely the answer is not going to be get saved, and definitely you will be losing the marks. So you have to be very cautious, and you should be having 100% mindset, that is like full concentration on in that 30 this 3 hours. Complete consciousness should be present, because all your years of hard work is going to get reflected in that 3 hours of period of time. See, whatever you have studied from the BDS first year to the finally to the internship also, or to the till the date, whatever you have studied is going to get reflected in that 3 hours period of time. At the same time, you don't need to worry, because like miracles do happen. Like you people might be thinking that it's like whatever we have studied, not we might be we are not up to the mark. It's not like that. You are up to the mark, and it's like a very simple exam. I say that it's like, I mean it. It's a very simple exam. At the same time, you should be having a very much good conscious mind, and also very much careful mindset. It's not that it's like just I will attempt something, something, something. You should not be like that. You should be very cautious for each and every question, because like all the 240 questions are important for you, and you should not be thinking that it's like 30,000 people are writing the exam. So am I up to the mark or not? Is my one of the most of the frequently observed kind of pessimistic nature that we observe. But at the same time, no matter how many people are going to write, you are going to deal with only 240 questions only. That's it. Whatever the thing that is in your control is only these 240 questions. Nothing other than that is in your control at all. You just have to focus on each and every question and think your mindset like I need to answer each and everything. That's it. Like if you know the right answer, then only answer it. At the same time, see, be prepared to in a such a stage that like I have to answer each and everything. It's not that it's like I will be just uh, going through the exam just like randomly. It's like you have to be very much cautious, and you also need to think that is like whatever you are going to perform in these 3 years, that is 3 hours, is what is going to reflect in your next 30 to 40 years of life. Because like it is the one that is going to decide which department that you are going to get, which college you are going to get, and also like whether you are going to do GDC or not. See, first thing is you doesn't need any superpower. You just need to be very much relaxed and at the same time cautious. Cautious thing is one of the very 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 important thing in the exam, definitely, because like you cannot be lenient to yourself in this exam, because if at all, if you do not click save and next option, definitely it is going to be in the vain whatever the artwork you have worked. And you need to also have a proper time management. That is like even if you click for the review later also, you need to be think and also you should arrange your time accordingly. Otherwise it is not going to be like a what you are thinking going to be planned for. You have to be very 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 much conscious, and also don't worry at all. The exam is very very simple, and it is like very simple exam, seriously, because like out of 240 questions you can answer it 140 to 150 questions directly without any like second thought. That is like if you know the concept, you will be answering just like that. Only the 60 to 80 questions are the one which are going to be decide, like somewhat tricky questions are going to be present. Okay. See, the thing that you have to have in this last minute of time is you need to have a very good sleep. Definitely you should have a very good sleep, and also reach priority to the examination center. And like entry time is from the 12 o'clock to 1:30, right? So try to be much more before only. That is like somewhere around 10:30 to 11 o'clock. You can just familiarize the environment with yourself, and then okay, it is like you can be having like somewhat like acclimatization is going to occur. Then you need to your thought processing will be running out. Okay, then only you will be performing much more better. Otherwise it is not going to be like a what you have planned. At the same time, sleep very nicely, like at least in these 2 days, sleep at least 8 hours compulsory you need, because like your mind has to be working like the 3 hours of time. You should be like very much faster rate, also very much precisely should be present. You should not be drowsy, you should not be like clumsy at all. Forget each and every stuff when you are doing the exam, like whatever the stuff that you are going to be remember, just leave aside and step into the examination all with a complete peace of mind. That's it. Like once you are entering the examination also, see, after taking your seat, do not sit there chat with any other one. Try to preserve your energy. That is like don't speak to anyone once you start, once you have your own seat in the examination hall, don't speak at all. Just drink a glass of water and then be meditate yourself, preserve your energy, and also store your energy so that your mind should be utilized in these 3 hours of time. Do not ever speak to other neighboring persons at all, because it is going to bring down all your battery levels. It is going to be like a somewhat exhaust kind of thing. Like you will might be seeing that your friends are over the examination center. So let's chit chat with them, or let's discuss like what you have studied, what they have studied, what they got in the grand test, what you got, how much you got in the grand test. It is not going to be like, see, you don't need to compare at all, because at the exam it's only you and 240 questions, that's it. It is not that you versus 30K. Okay, so be cautious, save your energy, stay hydrated, and also like most of the times, like I think most of the examinations also are AC ventilated, so you don't need to be worry about it. At the same time, preserve your energy, do not speak to any other people, because this is going to save your energy very, very, very much. Because whenever you speak, your lot of energy will be lost to your thoracic muscles and your respiratory muscles. So try to preserve your energy, meditate yourself. For the that is like at the 2 o'clock you're going to have your exam starting. So from 1:30 onwards, you start meditating yourself. Give yourself a break, like completely relax your mindset, keep everything aside, like whatever the issues or whatever the family issues or whatever your personal professional whatever it is, just leave aside, calmly answer it properly. You will be answering it properly only, and I hope you all come within a bright colors, and wish you all the very best. Okay, this if you have any other doubt, please do ask, like how to manage time or how to deal with any kind of questions or any kind of thing. If you have, please do ask. And always think like a laser focus is what you require. That is like the one thing I was been told to my that is I was been told by my father to me, that is like your mindset should be like an Arjun. That is like when the Guru Dronacharya has asked him what you are seeing, he said only that it's like eyeball of the bird. That's it. He didn't say I'm seeing the tree, flower, I'm seeing the branches, I'm seeing the leaves of the tree. He said that it's like I'm seeing the bird of the eye of the bird. That's it. That much focus you should be possessing. Otherwise, it is not going to be work out. You should be like best of the best, means your focus has to be like pinpoint focus. Pinpoint focus means pinpoint focus to uh without any distraction at all. That is one of the very, very, very important thing. Stop, like if you're comparing also, stop comparing. Never ever, like, because you don't know the other person's story. Now they should be knowing you, or now you should be knowing their story, because you are focused on yourself and 240 questions. That's it. If you answer all the questions, you're going to get definitely better marks, right? So the deal with the number of questions, that is like questions only. You versus questions. It's not that like you versus 30,000. Okay, it's one of the very, very, very important thing. And also, whatever you want to do in that 3 hours only, it is going to get reflected after the like on the May 19th. You should not be thinking like I should have done like that, I should have done like this. If that is like, if at all I have done like that, I would have get better marks. Like that, you should not be thinking at all. So if that thought processing should not be come into your mind, I want like you people to be giving your best in this period of time from now onwards to the Saturday 5 o'clock on till that time. You should be giving your own best. That's it. Best of the best. You will never ever regret if at all if you give them your best, because like that is going to put you in a somewhere where you even dreamt of. Okay. Is there anyone having any doubt? Please do ask, like any time management thing or any exam, the newly updated exam question pattern or any kind of thing. Please do ask. If not, can we close the session? Just drop a thumbs up in the chat. Okay. 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 All the very best, guys. Give your best, and miracles will happen. And you will be seeing like go through this OP OMR definitely tomorrow, because that is the one that is going to change the game of you. Because about 20 to 40 questions are going to come from that, because I have made the notes and very precisely. Like, that is like very important things and very like key points that will be asked very frequently are the one that I have covered them. And also I made those notes like in such a manner that is like it is up to the mark. Like that is like I made like something around like 1 to 2 months I have spent on that small notes which I have placed in this o- OPOMR one, because I made that much comprehensive one that is like if you go through that, definitely 20 to 40 questions will be in your hands. That is like somewhere around 40 thing is like 40 into 4 is equal to somewhere like 40 for the 160 marks in your hand in from that comprehensive notes. Please do go through it. Thank you. This is Dr. Vikram signing off. All the very best, guys. Give your best and see you soon. Okay. After the examination, I will be calling you back individually. Uh, let's be, it's like a best part. Okay. Thank you.